Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a very special guest from the Texas area, Rebecca. Rebecca, please introduce yourself.
Hi, everyone. My name is Rebecca Reynolds. I'm the administrative resident at Methodist Healthcare System in San Antonio, Texas. This system is half owned by HCA Healthcare and half owned by the Methodist Healthcare Ministries.
Thank you so much for coming on, Rebecca. It's a really unique and interesting system that you work at. And of course, you have a really great career in history and healthcare, starting, of course, at BYU with your bachelor's in public health. What caused you to get that bachelor's in public health? What was the kind of initial thing that started that journey?
Yeah, the advice I received going into college was to study something that you're passionate about, and that'll make your bachelor's degree fly by. So I took that advice to heart and I chose public health. Specifically, I got a minor in gerontology. I love serving this extra vulnerable population and understanding their needs and how to best serve them. So I had a great experience at BYU getting to do some research and then to understand the larger part of health across the United States and on an international level as well.
What do you like about gerontology? What's interesting about that for you?
I mean, I would say probably some of their risk factors that they have, the geriatric population, because of the many great elderly people that have influenced my life and my career. And so it's kind of just more of a personal level for me rather than a academic or research driven level.
I think those can be the most impactful, right? When it's a real personal passion that you have. So I think that's an excellent thing to mention there. And then, so just to, kind of chronologically speaking, what were some of your first roles, and then what led up to you doing your MHA MBA? How did that kind of transpire there?
Yeah, I'm happy to share more about that. So one of my first roles was a healthcare law clerk for Nemiroff Law Firm. I started that truthfully because I thought I might want to be a lawyer. That actually just helped me steer clear of that route and dive more straight into healthcare. Now, keep in mind that when I was studying public health, it was during the pandemic. And that's also when I had the opportunity to work in mortgages during the refinance boom. So I got to see what the strain on two different types of levels looked like, both healthcare and in the housing market. And I transitioned from that towards working in United Healthcare in their company called Optum. If you're unfamiliar with it, it's a value based care organization. And I was in the Utah and Idaho markets, and I ran the misalignment process, which looked at a more vulnerable population, people over 65, once again, for the most part, and people who don't want to see their doctor. I'm sure many of you have someone in your life that does not enjoy seeing their doctor. So my husband would be one of those people. But I wanted to work in value based care and also for an insurance company so I could understand the payer side of things prior to working in healthcare administration. I had the chance to do an internship for HCA, a patient experience internship. And that's when I, for one, discovered HCA, what it meant to be part of a company that treats you like family. And what I also love about working in hospitals is while I was there, every nurse, anyone you talk to in a hospital, they always say, my hospital. I haven't seen that in any other industry I've worked in. No one ever says my law firm or my bank. Hospitals, it's just a very personal environment. And it's kind of a sacred calling in that way because of the chance you have to serve people and to improve their lives. So after I did that internship, that's when I knew, for one, that I was willing to spend a lot of money on my next few degrees. We're just going to call it like it is. But then also, it gave me the passion that was needed for me to wake up every single day before school, ready to work towards getting this residency for HCA and the Methodist healthcare system. So that for me, that's unique. I don't know if my other classmates woke up with that same passion every day for school, and that's fine if any of you out there haven't found your passion yet. But that's really what led me to wanting the MHA at least, and then the MBA. I just really wanted to increase my understanding of accounting and finance and even economics. So that's how all of that tied in. It was all just for the benefit of my personal learning. I felt that I had a lot to do to learn and grow and to be ready for a challenging role such as being a resident for HCA and Methodist healthcare system.
Yeah, that's a wonderful journey, and very beautiful too. What you said about that, how hospitals are so personal. It's so important. Looking at, of course, the MBA MHA. Are you completed with that program yet?
I have completed it. Thank you for asking, Cole. I'm still on the high of celebrating my graduation back in May, but that was a great experience. I had so many professors that were there ready to mentor me, and they still honestly mentor me. They give me advice on how to handle this residency and also just how to understand hospital operations better.
I have to ask here, how many credits is that program, right? Because it's two master's degrees, and you've done a bachelor's, right?
Yeah.
And not to reveal your age, but it's impressive what you've accomplished in a short period of time.
I actually, off the top of my head, I couldn't tell you how many credits it was. Cole, it was a long journey. I've always been one of those people that's taking way more classes than anyone else is in a semester. That's just kind of who I am. That and that's kind of just how I operate as well. I'm not gonna lie.
You're not just single living on campus doing this full time, right? You're married. You have, of course, those responsibilities of being married. You're working full time, right? For we're doing these internships and things, and you're also doing this program. Do you have any tips on how you manage all of these things, right? Because to a lot of those who are just starting undergrad, especially, I know, I was taking 12 credits and I was overwhelmed. Of course, towards the end of it, probably like yourself, taking the maximum 21, it wasn't as hard. But any tips at all?
Yeah, I mean, you. This is where there's an opportunity for some self reflection for everyone listening to this out there. If I'm telling you that, I took 18 credits a semester and then I worked full time and sometimes did an internship or another job on top of that, I'm not saying that's what everyone's route should be or even has to be. Part of how that happened, I mean, I paid for all of my schooling myself. And so I didn't necessarily have the luxury to not work. But then also, um, it's much easier for me to work and go to school because I can directly apply some of the things that I'm learning in another environment compared to in school. But though I love talking about work life balance because that's the hottest topic I think of the last 5 years is how do you achieve work life balance. And how this was possible for me, most of my roles were remote jobs. That I think the pandemic and when I worked at the for prime lending, that department had actually been remote for like the last 15 years. Very, very impressive that they've been doing that. But I don't know if there's any other way that I could have handled work in school if there weren't some of these remote opportunities. When I did my MHA and MBA, I did as much remote work as I possibly could. My professors were pretty understanding of my situation for one. I actually still lived in Utah while I was trying to do this program in Texas. Now, schools are shifting away from remote classes, which I kind of think that's a shame. We could probably talk about that for the next 10 minutes, Cole, but just because of the opportunities it takes away from you in your personal life and at work. And I actually had to fly down to Houston a few times to wrap up some projects for school. And so then at some point you just have to choose your hard. That's a quote that I kind of live by is at some point like one day you're going to look back and think, okay, why didn't I get a master's degree, right? I had a school counselor who said, if you're thinking about getting a master's degree at all, Rebecca, do it now. Don't wait. Because one day you're going to wake up, the like 3 years will have passed and you'll kind of regret that maybe you didn't do some of these night classes. I've received a lot of advice, and I've had a lot of people who have been very understanding of some of my situations and what I'm trying to accomplish. When you just tell people what your goals are, they're more than likely just going to support you and do what they can to remove barriers. I think that's true at school, at work, and even in my personal life. I've an extremely supportive husband. I tell him all my crazy dreams, and he's never saying, "Why do you wanna do that?" He's saying, "How can we make it happen?" So that's a beautiful thing that I have going for me in my life, and I just always let people know what your dreams are.
Well, please let us know. What are your your dreams? I'm excited to hear them if you don't mind sharing. This episode of The Strategy of Health was sponsored by Modality Global Advisors. Modality Global Advisors optimizes hospital revenue, enhances patient experience, and delivers proven results. Visit modalityglobaladvisors.com to learn more.
Yeah, of course. So the biggest dream that I've recently accomplished is getting to be in this residency program for HCA and making it to the Methodist healthcare system market. And this program lasts for a year. I have the opportunity to learn as much as I can. So for my short-term goals, I spend every single day trying to learn everything I can about hospital operations specifically. And then since I also have an MBA, I'm still trying to learn more about hospital, even just like the financial operation side of things and some of the strategy. And so after I finish this program, I want to continue looking at hospital strategy and operations. Those are my two big passions, and there's lots of different roles that you can do to accomplish that. And this is where I, on a very, very personal note, I don't know if this will resonate with anyone else listening, but I truly believe that's what's supposed to happen in your life will happen for you. Sometimes, you can call it manifesting. That's another hot topic. People say just manifest it. And that's if that's what you believe in, of course. And I think I believe in manifesting, if that's what we want to call it. But the things that are supposed to happen in your life and the things that you're supposed to learn, they will come to you. And so I believe that looking forward, as I try to, master hospital operations, becoming, COO, maybe even CEO one day, or maybe VP of strategy. I'm not actually entirely certain exactly which of those roles I can make the most impact in, but I know that the correct role will show up for me in the correct position and in the correct timing. But for now, I'm focused on the daily learning that's required in my new role.
Yeah, that's a really important thing to have is to have, that setting the bar high in the future, of course, for your future goals, that you're always working as hard as you can, but then focusing on the day to day, trying to soak up that information, right? Especially in, a learning program like a residency. But looking back as well, here's what, is really interesting. You have more experience than most people when they exit their graduate programs, right? 2 years at Prime Lending. If you add up the three other experiences, there's another probably year or two, and then of course Optum, which was about a year. So you're coming out with 4 or 5 years of experience. Um, why do the residency, right? Because in terms of you probably could have gone into industry, right? Working at Optum, people can sometimes look at that and they might pay you more. So you might be sacrificing $20,000 to $30,000 a year. But why is that residency knowledge valuable and so important?
It is honestly a sacrifice. You did identify something that's a question my husband actually asked me. It's kind of why are you going to school again? Why do you want to do this residency when you could just have your career already? Um, and like I have no doubt that there's probably like a strategy, some operations job out there for me already that I could dive into. But what's really unique about the residency, and if you haven't heard or ever met a resident from HCA. HCA has multiple leadership programs. The program that I'm in is called officially the Executive Residency Program. And if you've never met one of us, that's fine. You're meeting one right now. So it might be a sacrifice in the short term. 1 year in your career to sacrifice isn't that much. I don't even know if I view it as a sacrifice because of the level of access that HCA grants you. So they just barely sent all of us out to Nashville to meet each other and to do what they called a leadership accelerator. They give you lots of opportunities to learn as much as you can about healthcare in the broad scope. And then I also have lots of access to things in a hospital that I normally wouldn't have access to. So most residents, they'll get to see every single department in a hospital. They'll get to meet every single type of person that works in a hospital. And you don't get to do that in other jobs. When I was at United Healthcare, I didn't get to meet every person that worked in the company. That and United Healthcare is also massive, but At HCA, they really prioritize your learning, and they call it exposure, getting exposure to every department. At some point, I'm going to do an EMS ride along to understand that part of the healthcare picture. But then I'm also in a unique situation right now in my residency program where I'm actually at a hospital that's being built right now. The hospital I'm at is Westover Hills Hospital. We will be opening this November. I am thrilled to have us open. So I've received kind of unlimited projects, is how I would describe it. It takes a lot to open a hospital. And that's again why I don't necessarily even view this as a sacrifice because of how many projects I've been given, how many people I've been able to meet, and how much learning. I've learned much more in these last 4 months than maybe I've even learned from compared to the year at United Healthcare, just because of how much HCA does for me to just learn.
I have a quick question about this. So I think a lot of people hearing this are going to be very amped, right? Including myself, right? This is very exciting. But what when you were looking, right? What is the difference between this and a fellowship? Or I mean, I'm sure you probably came across administrative fellowships, right? While you were looking at different things. What kind of narrowed it down to this program? And if you can shed any light on the naming of it, right? Administrative resident versus administrative fellow. I know that some people, the residency is usually only like a couple months, but this seems very different than what people traditionally would say like a residency is.
So a fellowship, I did look at another fellowship. I look at Mayo's fellow.
Yeah.
That's about a year program as well. And they do a pretty good job at trying to rotate you through different areas. Now, I don't have very much exposure to Mayo Clinic to speak more on exactly what fellows get to do, but the residency program for HCA is unique because of how intentional HCA is of building their leaders. It's kind of like they try to create leadership pipelines in some ways. When you become a resident, you kind of make the list, if you will. I don't know how to humbly say that, but HCA will just kind of take notice of people that are in these leadership programs at higher levels. I'm not sure exactly how high up it goes, but people are aware of you when you're signing up for these leadership development programs. We even have these clinical leadership development programs as well. So there's a clinical nurse leadership certification that we'll offer for some of our charge nurses, and HCA has some very intentional programs that they're pretty transparent about, you know, if you're going to be promoted or things that you need to keep learning and working on. There's basically every single opportunity that you could hope for in your career to learn in advance. HCA brings it directly to you as long as you're willing to keep working at it. I'm not going to say that I think being an administrative resident, and I doubt being an administrative fellowship and an administrative fellowship program is easy work. You and I mean, that's where it's kind of back to when you tell people what you want to do with your life, you're going to find a lot more supporters than a lot more people that try to hold you back. And so when you're in a program like this, if you end up doing a fellowship, if you end up in HCA's residency program, be intentional with letting people know that you're here to learn and you want to keep learning, that you don't want to stop learning. And I think you could apply that in any other job because that's what I've done, Cole, throughout
Yeah.
these last, 5 years of work experience. That I always say, hey, what's this? Teach me more about that. Why do we do that? How can we fix that process? I am that person at work asking lots of questions, but it's kind of a beautiful program that HC has created. One of their many leadership programs, and I'm lucky to be here, lucky to just keep learning every single day.
No, absolutely. I think it's good advice to, I think, that I'll give to look at both, right? Look at the fellowship like you did, look at the residency like you also did, and then kind of choose whatever program really fits for you the most, right? There's so many opportunities out there, and it's important to choose the right one that you really like. And you've really enjoyed your time right at Methodist, right?
Yeah, Methodist healthcare system is a beautiful system. So our mission statement is serving humanity to honor God by providing exceptional and cost-effective healthcare accessible to all. Now, you already know I have a public health background, so that accessible to all part resonates deeply with me. And then with my finance background, saying that we're cost effective. And then just on a personal note, serving humanity to honor God is huge for me. That absolutely adds more passion to me in this field, and knowing that we're 50% for profit, 50% not for profit. So I know that at least 50 cents on the dollar is going to be put directly back into the community. So it's kind of beautiful there. I've really enjoyed my time. Do you have any specific questions about my time here at Methodist Healthcare System?
Absolutely. I have a few here. And so one of the ones is about kind of the impactfulness of projects that you've been involved with. How impactful do you think the projects have been? Do you think that, one of the things that I guess a lot of people say that they're worried about when they go into an internship, a residency, a fellowship, an LDL, they're always worried about the projects being busy work, right? So how is
Right.
your experience with the projects? Are they mission critical? Are they high value?
Absolutely. Since we're trying to open a hospital in November, so I directly know that if I don't do this, we're not going to have that in our hospital. We're not going to be able to serve patients if we don't have that. They've brought me into some of the equipment ordering processes. So if I don't call the sales rep to get a quote for this piece of equipment, we simply will not have it for the patient.
Mm.
Every project that I've been brought on has been very intentional for. I have a very wise CEO. She's always looking for things that I lack in. Truthfully, I didn't understand the equipment ordering process. And so she or someone else on the team will just identify that I don't understand something, and whether they just want to tell me how it works or give me a project is up to them, but it's usually give Rebecca the project, have her try it out, and see if she can accomplish it. Of course, I ask questions along the way, but I I think probably 95% of what I've done hasn't felt like busy work. The other 5%, I think you probably feel a percentage of busy work at any job.
Oh yeah.
That's just kind of how it is. There's things that are always repetitive because even in healthcare, it's one of the most dynamic environments.
Oh yeah.
There's still just things that you do every day. There's some meetings that you attend every single day or every single week, right? And it's up to you to find if that's monotonous or if you can find the value in it.
Yeah, no, of course, of course. I mean, I'm sure even the CEO, right, has a bit of busy work that she has to do every day. So, no, that's excellent. And then, any recommendations, just briefly? I really appreciate your time again. But any questions, briefly, or tips for those who are applying? Anything that those who are interested in attending should be aware of?
Yeah, if you're applying to this residency position, to a fellowship, or to just any job, this is the advice that I give to people on LinkedIn all the time who kind of ask me this question. The advice is you should reach out to someone that's in that role, ask them how they like it. So you can check that box right now. If you're interested in this residency program, you can check the box. You've kind of heard a little bit about my experience. I'm always happy to talk more about it. But you should also talk to someone that has advanced from that role to either the next role or to somewhere else and ask them why they did that, and if they felt that they were prepared for the next role. So I did that when I was looking at this residency. I talked to people who had advanced. And also, once you understand the residency, I think that makes the interview process a little bit easier when you know what job you're applying for, right? So couldn't hurt. But then I now this is where this I don't know how many people give this advice on LinkedIn, but I sometimes actually recommend that people talk to people that either didn't get the position or chose to not move forward with the position. So find someone that, applied, either didn't get the role or that's just working somewhere else, and ask them why. Now, I say that advice because I'm assuming we have some very emotionally intelligent people on this podcast. And when you're talking to someone that left the position you were in, sometimes you have to take some of their advice with a grain of salt because some people leave because of relationship problems and you might not have those same relationship problems. So be mindful in some of the advice that you're hearing from someone that's an ex-employee. I've done that for probably like the last 3 jobs. Talk to an ex-employee. I've heard very interesting things, but you also sometimes hear the truth. So That's up to you if you want to take that third step. Obviously, the most valuable step is talking to someone that's in that position.
Yes, absolutely. Yeah, very good advice. And that last one's unique, right? Sometimes people are too afraid to mention that, but it is really important, right? I like to hear the good and the bad and then synthesize it together. Every organization has people who probably have something bad to say about it. I mean, that's
It's
just,
true.
these organizations have been around for hundreds of years, right? So, but it's good to be able to take both and kind of synthesize what you want to move forward with. So really important advice. And thank you so much, Rebecca, for your time, for coming on again on a Sunday afternoon. I really do appreciate it. And I hope that we can stay in touch and have you back on again as you move up to your CEO or president position.
Well, it's been wonderful getting to know you, and thank you so much for having me on the podcast so I can help some people navigate their careers.